Welcome to Doc Talks Detox. I'm Dr. Caitlin, and on this channel I talk about all things drainage. Now you are right smack dab in the middle of a 7-part series where I'm going through the specific 7 lymph nodes one by one in the order in which they need to be addressed. Now today's video is number 4. So this is the first video you're seeing. Make sure you go back and watch the first 3 videos because all of these videos build upon one another. You can't just jump into video number 4 with this lymph node because it's not going to drain properly. Now with that being said, you also, like the other ones, want to stay till the end because I'm going to show you exactly how to open up the lymph node, what to do, and talk through some of the things that you may be thinking. Because guess what? I've been doing this a long time and I've heard a lot of different things and I get it. Lymphatic congestion, lymphatic drainage is one confusing and it can be frustrating. But the reason it's frustrating is because I find that people don't do it consistently enough. That's number 1. Number 2, they don't do it for a long enough period of time to actually see results. And then number 3, they're not on the exact right location. If we're not on the right location, if we're not following order, direction, pressure, we're not going to see or reap the benefits of doing the specific 7. So if any of those things are confusing to you, like the order, direction, pressure, go back and watch that video. I talked about order, pressure, and direction and how important it is for proper lymphatic drainage. All right, so today's a big one. Today actually helps drain our breast tissue and our arms. So if you are somebody that has any type of fluid retention in your arm, whether it's your fingers, your wrist, your hand, your elbow, if you have arthritis, like arthritic type pain, if you have joint pain, especially in the morning, if it takes you a minute to get going, if you have muscle soreness, you probably want to consider opening up this lymph node. But not before you do the other 3 first, because remember, these build on another. Because what can happen is when we have congested lymphatic fluid in an area, it's waste fluid, it's waste products. And what it's going to do is it's going to drive inflammation. Inflammation, regardless of where it is going to break down our body. So when we have inflammation, if it's breaking us down, of course we're going to have things like pain and discomfort. And guess what? If you have pain down here, your doctor might not know to look further up at the cause because this node is actually in our armpit. You could have congestion in your armpit. Your armpit might not be draining properly, which will then cause a backup into your arm. Now you might be like, okay, well, what about breast? What could happen with breast? Well, you could end up having the diagnosis of like dense breasts or fibrocystic breasts, meaning you have fibrotic breast tissue along with cysts. You may end up having painful breast changes like swelling and discomfort throughout the month. And that could be due to the fact that lymphatic fluid isn't draining properly. It could be also due to the fact that hormones aren't balanced. And remember, lymph helps move progesterone, and progesterone keeps our estrogen in check. So if we have anything going on in this area, we absolutely need to be looking at our armpit. Okay, so let's talk about the armpit. Because guess what? Out of all of the nodes that I talk about, this one probably gets the most kickback. Where people tell me I'm body shaming or it's just weight, it has nothing to do with stagnant lymph. I get all sorts of crazy comments, but it's because people just don't know. And please understand that there is absolutely zero body shaming on my page about anything. I simply want to show you guys what could be going on so then you can do something to address it. I want to give you guys the tools and empower you to make changes. So how can you know, or what is one way that you can check to see if you have a lot of congestion? Lift your arm up. Do you have a pit? Because remember, think of it this way. It's called an armpit. It's a pit. We're supposed to have a pit, okay? If we don't have a pit, if we have more of a puff, and right now I'm pulling my skin to make it look flat, okay? If you have more of a flat area or it's puffy, that usually means you have congested lymphatic fluid there. Now remember, if you wear bras, if you wear tight clothing, that's going to further increase the congestion. So you may be saying, well, no, it's just because I'm a larger individual. Dr. Caitlin, that has nothing to do. Well, you know what? I have individuals, plus size clients, plus size academy members who thought the exact same thing. But guess what? After they've been working on their lymphatic system, they're starting to get a pit back. Woo! That means that they're draining. So what I want you to do is I want you to look at it more from a standpoint of let's get this fluid draining, because this fluid from our armpit is going to drain into our apical node, which was video number 3. So again, if you haven't watched the first 3 videos, you gotta go watch them because these do build upon one another. You cannot just jump in at video number 4. It's not gonna work. You gotta create that fluid gradient because fluid flows from high pressure to low pressure. So if you have high pressure above, you're not gonna be draining the area you're working on. So you always work in the order that I'm teaching these. Okay, so what we're gonna do, we're gonna use the pads of our fingers, okay? I usually don't use my index finger. Reason being, we tend to push harder with our index finger, and lymphatic drainage is not hard, okay? It's not hard. Now this is gonna be more of a pumping motion that you're gonna be doing in your armpit. So what you're gonna do is you're gonna bring your arm up. You're going to ultimately stick your, and you'll see I'm sticking my whole hand in there, but you're gonna stick your hand in there as if you're grabbing like that little chicken wing, right? That pec minor major muscle, the tendon, the insertion. You're gonna stick your hand in there. I like to pull my index finger out because, like I said, you can really dig it in there. You can leave your hand up if you want. I find most people do better by dropping it down. And what you're gonna do is you're going to pump up 30 times. It's not fast, you're not doing this, okay? It's 1 pump a second. Now, what you're gonna notice is this might be tender. If you have a lot of fluid retention in that area, if you have a lot of a puff, if you have more of a puff, this might not feel awesome initially, okay? You may actually notice too, like, oh my goodness, as I'm doing this, my breasts feel like the size is changing, or you may notice like the fluid in your hands and things like that start to go down. That's amazing. Be consistent though, because just like everything, it doesn't happen overnight. Now you'll see in this video, I'm only doing one side. You can't properly do both armpits at the same time. So remember, I'm all about doing things efficiently and, you know, saving time, but this one we can't. So then we're gonna switch sides. So arm up, we're gonna stick our fingers in the deepest part of our armpit or where it should be, pull the finger out and then up. Now 30 seconds or 30 pumps. Now you may feel like you have to do this more, and that's okay. You may actually have to do more in the beginning to get things moving, and that's totally normal. I have clients go up to 50 pumps or 50 seconds per lymph node. Now the reason that is the longer something's been stagnant, the thicker it's gonna get and the harder it is to move it. So doing things nice and slow but being consistent, you're gonna get better results, much better results, and it's gonna be faster. Now, how fast you might be asking, I have no idea. Everybody responds differently, and it's ultimately dependent upon how long you've had that specific like lymph node congested, what else you have going on. So be consistent. And like I said in the other videos, this does build upon one another. So this does not supersede everything else that I talk about. It's one tool that I highly recommend you add into your arsenal. So that was lymph node number 4, the armpit or axillary. It's also called sentinel. And so what you want to do is do these in order, and you want to start working through all 4 of them at least once a day. If you can do it twice a day, you're going to get better, faster results. Now, if you're someone that's sensitive, go slower. All right, I'm so excited. We're more than halfway there, guys. Happy draining. And if you're new to my channel, be sure to subscribe and hit the bell button so that you get notified for the next video, because the next video is gonna be number 5, which means we only have 3 more to go. Thanks for watching, and I'll see you next time. Bye.